this is a very important study for all of us in the world to learn how effective the vaccine is in preventing transmission. And currently, the CDC recommends that even if you've been vaccinated, you should still continue to mask and socially distance, because we don't know if the virus can still be infecting people and if they can transmit the virus to other people, even if they've been vaccinated. So this is the key to our freedom. This is the key to opening up universities, opening up businesses, being able to fly places. What I hope is that we'll find is that asymptomatic infection is decreased, but we don't know that yet. And we need to know that before we can safely, relinquish these very inconvenient things like social distancing and masking.
What's the motivation for students to launch into a 4-month study when they could get the vaccine today if they wanted to? And many will wait and say, I want to do this for science, I guess.
Yes, we've really been impressed by the altruism of many of the participants in this study. Of course, they have a 50% chance of being randomized to get the vaccine. But those who haven't been randomized to that arm have been very calm about it and said, I really want to know the answers to these questions too, and they want to play a part. I should note, however, that if somebody changes their mind and feels like they really do need to get the vaccine after having been randomized to the deferred arm, they are still able to go out and get the vaccine, and we will still continue to follow them in the study.
Thank you so much. All right, just 1 second. I'm going to fill out some of this stuff, and then I'll ask you some questions.
At a recent vaccination event for the study, students Ivana Reynolds, Blake Gherkin, and Becca Bargo shared why they signed up to participate.
Yeah, I feel fine. I'm happy I did it. I think it's a good thing that people should get. I mean, it's at your own discretion, but I definitely think it's a good thing.
Okay. Are you feeling sick today?
No. I know there's a lot of questions and not a lot of answers, and participating in the study is a great way to find answers and better understand how transmission once you're vaccinated works.
Do you have a weakened immune system from any medicines or conditions?
No, it can help so many people, so it's just really important that we learn everything we can about it.
Good.
Back in the studio, I asked Dr. Connick what she hopes students take away from the experience.
I hope that they get a sense of fulfillment for having done their part to help the country in terms of getting out of this terrible pandemic that we're in. They do get some payment for participating in the study, but they do a lot of work too. They are supposed to swab their noses every day, and they keep an e-diary, and we feel that the compensation is appropriate for the amount of effort that they're going to participate.
You study public health. You know how a virus can mutate. Is there a risk associated with doing this? I imagine that there isn't any study, correct?
So all studies have risks. Even the vaccine has risks, as we know. So we are recruiting healthy students between the ages of 18 and 26. Certainly, they're at risk of getting COVID if they don't get the vaccine. But the risk of COVID in very healthy young people is quite low.
Once the study finishes, when do you anticipate seeing results?
I think that we will have results of this study before the end of the year, which is great.
Dr. Liz Connick from the College of Medicine at the University of Arizona, thank you.
Thank you very much.